The Plastic Surgery Channel News, brought to you by Mentor, maker of memory gel breast implants.
Hello and welcome to Plastic Surgery News. I'm your host, Deanne Moore. Thank you for joining us today. In this week's report, find out about the rising trend of breast reduction surgery among British men. Learn what the Food and Drug Administration is saying about a new eyelash enhancement product. And get the scoop on why Botox sales may soon be in the billions. All of that coming up, but first, medical tourism is a rising trend in the world of plastic surgery. But not all the tourists are coming home satisfied. A recent internal survey of the British Association of Aesthetic Plastic Surgeons showed that doctors are seeing an increase in patients who have traveled abroad for low-cost cosmetic surgery and later needed corrective work back in the United Kingdom. The top 5 problem regions are reportedly South Africa, Poland, Belgium, Turkey, and Thailand. A related study of medical tourism websites showed that 90% of the sites did not mention the possible risks or complications of surgery. 39% of the sites did not include actual details about the surgery, and more than half of the foreign surgeons only offered consultation online or by telephone before the operation. The report noted that breast augmentation and tummy tucks are among the most popular procedures for medical tourists. But the apparent lack of post-operative care leaves many patients from the UK needing extra help back home, placing a burden on Britain's national health system and British taxpayers. Next, in the news, it seems many surgeons are using a new non-surgical technique to provide nipple enhancement. The technique involves using an injectable filler called hairiest in breast augmentation or reduction procedures to enhance the shape and size of the nipple. Specifically, the filler can help create a visible balance between the size of the areola and the size of the nipple. Hairiest is a calcium-based gel normally used to correct facial wrinkles and restore tissue volume. But some surgeons say that it can also smooth out the texture of the nipple and give it more volume. This can be helpful after a breast augmentation or reduction that improves the breast but leaves the nipple area looking disproportionate. Using filler injections can also reduce the appearance of scarring of the breast so it looks more natural and aesthetically pleasing. Now, currently, there are no real scientific studies on the safety and effectiveness of the technique.
Just because you hear that something is new and exciting does not necessarily mean that it's safe and effective. And that's what I always tell my patients. Basically, the nipple areola complex is a very vascular area. We worry constantly about clogging a duct. Worrying about infection in that area. We see that when patients are breastfeeding and they have a clogged duct, they can develop a mastitis. Any product that you would inject into an area, such as the one that we've been hearing about now, the risks are there that you can develop an infectious process, or if it does stick around in the tissues for a year to 2 years, as the company states that it lasts for that period of time, we worry that if the patient is going to be getting a mammogram, will this show up on the mammogram as a spot or an image that may pose a question to the radiologist and to the oncologist. So for that reason, I usually say, let's wait for something to be tested. Let's look at all angles of this before we go for the cosmetic plunge and make sure that we do something safe before we introduce something into the breast.
Patients interested in nipple augmentation should discuss the procedure with a board-certified plastic surgeon before choosing to undergo breast surgery. Coming up next, see how the trend of breast reduction surgery is rising among men in the United Kingdom. And find out what the FDA has to say about a product that promises longer lashes. But first, we're going to take a quick break. We'll be right back.
Hi, I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. Last year, more than 350,000 women decided to get breast augmentation.
It helped me understand what my body would be like after the surgery.
And speaking of hard facts, let's talk about your olfactory organ.
So a prospective patient, when they're looking to have surgery, must always understand that every single surgical procedure has its import, and they must be concerned with the quality that's being delivered to them.